Roshan Kalghatgi was shocked when his 73-year-old mother tested positive for the coronavirus in July, nearly 2.5 years into the pandemic. "I thought it was a fluke," the Redwood City resident said. "I made them do it again." His mother, Manisha, had eluded the virus at a Pennsylvania assisted living facility as COVID-19 devastated group facilities for the elderly. She had avoided infection again when she flew across the country to join Roshan and his family in San Mateo County, where she would tickle her 4-year-old grandson and faithfully follow his repeated requests to show him her belly button. She had been vaccinated against COVID and received booster shots as well, Roshan said. By July, COVID wasn't the top threat to Manisha on his mind. His mother had been struggling with kidney disease and Roshan fretted about how to keep her going to dialysis, which she had abandoned even as Roshan agonized about what it would mean for her health. Manisha was stubborn about the right things and also stubborn about the wrong things, Roshan said ruefully, remembering how she had raised 2 children alone after the abrupt death of his father from a heart attack, and how she had moved repeatedly to find the best schools and services for Roshan. She died in August. "To lose her now," Roshan said, "just seems so strange. Americans have been urged to learn to live with the coronavirus, but this summer, hundreds were still dying from it each day." The death toll has fallen from the grim peaks of past surges, but has persisted in recent months, averaging more than 400 lives lost a day from June through August, according to data from the Johns Hopkins Coronavirus Resource Center. At that rate, COVID still amounts to one of the biggest causes of death in the U.S., even as public officials herald the availability of vaccines and treatments. "The coronavirus no longer controls our lives," President Biden declared this spring and again this summer. His COVID-19 coordinator has stated that most COVID deaths are now preventable. Yet in Los Angeles County, more people died of COVID between May and July this year than during the same months last year. The virus claimed the lives of nearly 800 people in L.A. County in those months, compared with nearly 500 a year earlier. Elderly people bore the brunt of that increase, with a death rate that had tripled among people who had reached their 80th birthday. "There's no question in my mind that ageism has been an enabling aspect of our inadequate response to COVID," said Dr. Michael Wasserman, a geriatrician and chair of the Public Policy Committee for the California Assn.